Thank you very much, David. Next, we have Doug Layton, Vice President, Planning and Sustainability at Brookfield Residential. Doug?
Thank you very much, and fantastic to see such a full crowd. It's obviously a topical subject. I know Alberta Health Services organized a similar conference in February, and the Urban Land Institute had a similar conference in Los Angeles about a month ago. One of my colleagues attended. Wanted to say thank you to the organizers for including me. I think, however, you've made a really terrible mistake, because actually you should have panel members who disagree vehemently. And all three of us share a real passion for urban design. And I know I expect some difficult questions from the audience, but we are all, I think, pretty aligned in terms of seeing that as the way forward to this link between health and the built environment. First of all, if I can find the remote here. Winston Churchill once said, first we shape the buildings and then the buildings shape us, and I think that's true of cities as well. Just some other quotes, and I think it's always important in the debate to see, first of all, if you agree on the terminology. And so I think you can see from these two that there is no debate. The top one, of course, is from a very well-respected medical institution in the States. The bottom one is from the Urban Land Institute, which is a long-established voice for the development industry across North America. I think there are 36,000 members, and a new chapter here in Calgary, which is making its priority as well this year. So I don't think there's disagreement at that level. That's always nice. I'm going to continue on my positive tone here, because I think in Calgary, and as Canadians, we have a bit of an inferiority complex. We like to slag ourselves off and think that we're not as good as Vancouver or the States or other places. And these are direct rankings from internationally respected places. So we are, and I'm not saying we can't do better. We should and we must, but we are generally a pretty healthy country. Mercer, and you can quibble over their methodology, said we were the top eco-city. We're the cleanest city. We're the number 5th most livable city from The Economist. Number 3 healthiest Canadian city, and number 2 in active lifestyle after Vancouver. And number 10, the most walkable Canadian city. And I was very pleased to see on your map of walkability that alone among the 1980 subdivisions, our Mackenzie town had a red dot. So thank you for that, Bev. I think it's also important to remind ourselves that much as we're all passionate about urban design and we like to think it's the most important thing in the world, it is not the only determinant of public health, and there are many, many other factors. So before we put all of our effort into improving the built environment, there are other areas, the software, that are equally, if not greater, of greater importance. And we're very, very lucky in Calgary to have a wonderful health system. So I'm not putting that to excuse or deflect debate from the built environment, but I just think it's worth remembering that. What we do is the hardware, then the software is of equal importance. If I can return to the Urban Land Institute, and I don't think it's any coincidence that this is their priority for the next 2 years as well. They've issued a number of publications. I think a new one came out today on exactly this subject, but this is their attempt to boil it into 10 basic principles for the land development industry. And I think if you looked at some of the points that David raised, a lot of these are already in our municipal development plan. So number 1 is put people first, whether it's through walkability or places people want to live or quality of life. The second is that economic value, and don't forget these are aimed at the development industry. Walkability is profitability. We'd be crazy to create places that were not walkable. Empower champions for health, and we are reaching out to our health providers. We're in dialogue right now with Alberta Health Services, and I would encourage that dialogue. I'd love to talk to anyone afterwards on this. We have a relationship with the Faculty of Environmental Design, of which I'm an alumni, I'm proud to say. We're helping sponsor a studio led by Dr. Greg Morrow on exactly this subject. So it's something that we're very keen on, and I think we have some passionate, energetic people in this city that we need to support. Energizing shared spaces, so it's not enough to create a plaza or park without the program or activities or the design to make them work. Again, David provided some fantastic examples of energizing fairly bleak places like the First Street Underpass. That's a fantastic victory. I look forward to seeing that. Making healthy choices easy. I mean, how many buildings in Calgary, you take the elevator, you can't find the stair or the stair's locked. The people who designed our new building very cleverly put giant stairs in the front. No one takes the elevator. And so we need to make those choices healthy, whether it's the scale of the building, the entire neighborhood, or the city. Ensuring equitable access, and I think this deals with issues of affordability, exclusion, social exclusion or inclusion, and so on. In Calgary, maybe the flip side of our inferiority is we can sometimes be a bit smug, and we don't see that not everyone is sharing in the wealth and the quality of life that many of us enjoy. So that is incredibly important, and we need to keep reminding ourselves of that. Mixing it up, no disagreement. We have our company is lucky enough to have an infill division led by Jaden Tate. We have a commercial division led by Warren Polson. We don't build just houses. We very much believe in building communities which have places to shop, work, play, so on. So you won't find much disagreement within the industry on that. Embracing unique character, I think we've been guilty in the past in Calgary of picking names like Chaparral or Silverado, or I'm picking on some. But we do need to go back to what Calgary is about and authenticity, and I think that's very important. And build on, again, this sort of ersatz character of copying other places. We have a unique climate, we have a unique character, history, and geography, and so I'm very pleased to say, for example, in our newest area in the north, we've called it Livingston after Sam Livingston, and we're working very hard on placemaking that tries to reflect what Calgary is about. Promoting access to healthy food, and I think this is important, but I do think the fact that this is an urban land institute based in the States, there are a lot of American cities which have true food deserts. There are no grocery stores at all in the inner city or downtown areas. We're lucky. We do have good access to food here. We live in a harsh climate, so I love to go to the farmers market. I encourage more of them. So yes, we do need access to healthy food. It's important, but I don't think it's as severe here as it perhaps is in other cities. And lastly, make it active. Calgarians are very active, and I will compare our pathway system, linear meters of path, with Vancouver any day, having lived in both cities. We are very, very lucky, and we need to keep that up. City of Calgary deserves huge credit for its recreation centers and not just the buildings, but the programming. We are indeed fortunate. At the risk of seeming self-serving, I think we have a lot. We tend to look elsewhere for success stories, and maybe it's time for Calgary to actually try and create some success stories of its own. So we were lucky when we developed Mackenzie Town and getting a lot of attention for Calgary. It was groundbreaking for a project 25 years ago. I think Garrison Woods has done the same, Quarry Park. We don't have a lot of good examples, and why don't we look at creating, not just copying someone else, but doing our own flagship healthy community. So we have an example in South Seaton, and we have a number of partners in the surrounding area. Rob Olorenshaw in Section 23, one of the most progressive developers in Calgary, is one of our partners in the surrounding area, other landowners. We have $1 billion, I don't know the exact figure, $1 billion plus health facility, which is absolutely astounding for those who haven't seen it. And effectively, the city has designated this as the downtown, mini downtown for the south area. Could we build on that? This is infrastructure in the ground. A week ago, we had the Tri-Services building opened by the City of Calgary. There's a public high school, a major public high school. I believe it's at the working drawing stage. A major regional recreation center by the City of Calgary, a regional park. We're working right now with a separate school board and the city to create a new separate high school as well. And again, I come back to the South Health Campus. So that's the kind of the obvious health and wellness stuff. But what about the walkability, the interconnected parks, and some of the other ideas? And I'm looking forward to seeing the results of Dr. Greg Murrow's studio next week in terms of what the students come up with. I think as well we're a city of formulas, and they say that don't repeat the process of last year if you expect a different result. And we have formulas. I'm talking the industry as well as the City of Calgary. Sometimes when you overlap those formulae, you end up with perverse results. And if you've seen the movie Radiant City, you'll know what some of those results can be. So the engineering department has its manual, the transportation department, the parks department, the planning department, the water resources, and we have our formulas. So, I think that we need to break that mold. We need to foster creativity, not conformity. Right now, it's far too easy to follow those formulas, and you end up with a standard result. So. I like the approach that Roland Stanley, the new, not so new, planning director is brought to the city of being based on outcomes and performance rather than rules and regulation, I think that's the way forward. And being a passionate about urban design, I think that is the urban design first and the planning second. So I'm going to return just to close off in terms of asking whether this ULI checklist might not be, maybe we couldn't combine this with the principles of the municipal development plan as our checklist of what makes a healthy project or healthy community or neighborhood from one that's less healthy. So in conclusion, I guess I started emphasizing the positive. I think we're off to a very good start in Calgary. We at least agree on what the problem is. We have laid a fantastic foundation. We need to do better, absolutely. Thirdly, I think a lot of you are either in the academic world or medical world, and I think we, the industry and the city, need more research. Very impressed by the work I saw in the hallway here. And so we need metrics to measure what's successful, what's not, what are we doing right, what are we doing wrong. Otherwise, how do we learn? Collaboration is the key to success. You know, we enjoy working with other landowners. We enjoy working with the university. We enjoy working with Alberta Health Services and other groups, and with the City of Calgary and EVDS in particular. So if we're going to, let's get our act together, and let's, if I can postulate my response to Bev's question, why, I think it's about alignment. I think there's a lack of alignment, a lack of dialogue, and hopefully today is the beginning of that. So we're all in this together, and I look forward to a lively discussion and debate. Thank you very much.
Thank you very much, Doug.